This is a presentation on patella fractures. Patella fracture occurs when there is a break in the patella, also known as the kneecap. It may occur when a person experiences a high blow to the patella, such as a hard fall or a collision with a hard object. Excessive stresses on the patella for long periods of time may also contribute to a fracture. There are various types of patella fractures: an undisplaced fracture, which typically does not require surgery. A transverse fracture usually requires surgical treatment if the extensor mechanism is not intact. There are lower or upper pole fractures, multifragmented fractures with or without displacement, vertical fractures, as well as osteochondral fractures. The risk factors for patella fracture are age, being postmenopausal, participating in high-impact sports such as football, rugby, or soccer, osteoporosis, thin bone or muscle mass, and trauma. Symptoms of a patella fracture include intense pain in and around the knee, tenderness to palpation of the patella, swelling, pain when moving the knee, and the inability or difficulty to extend or straight raise the leg. Key exam findings are tenderness at the patella, inability to extend the knee or hold the knee straight, and X-ray findings on the lateral view. Non-operative treatment includes a knee brace with weight bearing and full extension if the patient has an intact extensor mechanism. If there's a non-displaced, minimally displaced fracture or vertical fracture, there can be early active range of motion with the brace, improved knee flexion within 2 to 3 weeks, and early weight bearing and full extension. Operative treatment includes open reduction or internal fixation with a tension band construct or screw fixation. This is indicated when there's loss of extensor mechanism, when there's an open fracture, when there's displacement of more than 2 millimeters, or the fracture is gapped more than 3 millimeters, or if there's a patella sleeve fracture as seen in children. In the tension band construct, the tension band converts tension forces into compression across the fracture site. You drill 2K wires longitudinally through the patella fracture, you pass the wire to form a figure of 8, you shorten both the proximal and distal pins to prevent skin irritation, and then you twist the wire to tension the construct. You can see here the picture in the upper right, a tension band construct.